Welcome to the Health Channel, all health all the time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios. According to the Centers for Disease Control, every 40 seconds, let me repeat that, every 40 seconds, someone has a stroke. That someone can be anyone, no matter your age, no matter your race, nothing. Seconds matter for time and recovery, both of which we will be talking about today because it's so important. Joining us to talk about this very important topic is Dr. Jose Vargas, a physical medicine and rehabilitation physician at West Gables Rehab Hospital. Welcome.
Thank you.
Thanks for being here.
Thank you so much.
You know, I want to repeat your title because we've had a lot of doctors on our show, and a physical medicine and rehabilitation physician. Can you explain what that is, if you don't mind?
It's a complicated story.
Well, we have about an hour.
Okay, well, they didn't know what to do with our specialty and how to name it, so we're actually known as physiatrists. And most of us go by physiatrist, but when you hear physiatrist, some people think psychiatrist, some people even think podiatrist. So, but it's essentially a physical medicine rehabilitation comes from the background of our specialty. Initially, after World War II, people were coming back from the war with what they called back then shell-shocked. And those were what we call today brain injury victims. And that's where the physical medicine and the rehabilitation part of it came. And then eventually there was a push towards musculoskeletal medicine. And I know your stations had colleagues who specialize in that non-operative orthopedics. Most of them are physiatrists, so we do the whole body. In Europe, there's a big push towards physiatry because we encompass everything within the body and not just medications necessarily. It's physical health as well as emotional, spiritual, whatever the case may be. But we are MDs or DOs. We go to medical school, and we do 4 years of training in this specialty. I actually had done internal medicine before, so I did both.
So today we're talking about stroke rehab.
Correct.
How often do you, how often do you work with stroke patients?
Every day. I just got back from the hospital. We have about 20 patients right now. 20 in our hospital that have had a stroke, either acutely or even on the outpatient side. We stop by to make sure they're still doing okay. Our own hospital handles about more than 200 cases in a year, and they're usually hospitalized between 2 and 3 weeks, a little bit more. It's pretty severe. You're talking about 800,000 people suffer a stroke a year.
That's why I was shocked with the every 40 seconds someone has a stroke. I thought, my gosh, and I even checked with my producer, is that correct? And she said, yes, it is. And I was shocked. I was also shocked to read the following, which is stroke is the 5th leading cause of death and continues to affect more young people than ever. The Centers for Disease Control has the facts. Take a look. Great information there from the CDC. Just a reminder, as always, we'd love to hear from you. If you have a question for Dr. Vargas, there's the toll-free number, 855-796-4475. We would love to hear from you. Okay, so here's another fact that I read here. 1 in 20 adult deaths are related to stroke. Why are these numbers so high? And I just also mentioned that it's happening in younger people. What's going on?
So, I mean, the CDC video illustrated some of the issues we're having, and it's a societal issue. We're fatter than we've ever, can I use the word fat?
You can.
Okay.
Absolutely.
We're more obese than we've ever been, trying to be politically correct.
It's all right.
We're more sedentary than we've ever been.
They say sitting is the new smoking.
And we just lead generally unhealthy lives, and the younger population is actually much more unhealthy than the older generation.
Awful.
So you start adding those facts, you see why younger people are getting diabetes earlier than ever before. Hypertension, hypercholesterolemia, which is high lipids, or the cholesterol in your blood is higher. All those things are happening at younger ages than we've ever experienced. And then you add to the fact that stroke in itself is very debilitating, and it can be, whether it's what we call an ischemic infarct, which is usually due to high blood pressure affecting a part of the body, or what we call the bleeding strokes, which can be very fatal. So you add all those factors and you have a recipe for a bad outcome. Yeah.
Absolutely. And there are risk factors that I want to share with our viewers, sure. Doctor. Let's take a look at these and chime in on some of them. I mean, there's a whole host. You talked about high blood pressure and cholesterol as well. Those are two bad ones. Smoking, obviously. Obesity, correct. You mentioned. Let's chime in on medications, heart disease, and physical inactivity and stress, if you don't mind.
Sure. So from a stress standpoint, we all know that those of us who are leading very stressful lives and don't have an outlet, that in of itself can increase your blood pressure. But there's literature out there and people talking about how stress negatively affects you in general. And from a high blood pressure is probably the number one leading cause of
That's why they say know your numbers. It's so important. We say that a lot on this show. Know your numbers.
We have a lot of our elderly population that when you first interview them, you ask them, do you have high blood pressure? And they say, no. And then you see they're on 3 medications. And you ask them, why are you on these 3 medications? Oh, doctor, this helps control it. I no longer have high blood pressure. So that lack of knowledge within our community, that if you have this high blood pressure, we need to control it, because long-term it leads to a litany of issues, including cardiovascular disease as well, as you know. And
even friends at my age that I tell them, do you know if you have high blood pressure? Oh, no, I don't. I'm like, well, how do you know? And they'll tell me, oh, I don't. But how do you know? And one of my friends went to go get her blood pressure at CVS, and shazam, she had the diastolic was high. So there you go.
And that happens.
Know your numbers. That's all you have to do. We have one patient story who never considered his risk for stroke or the warning signs of having one. Happens a lot. Fortunately, those near him knew what to do. Take a look at this.
I was one of those guys just afraid of the doctor. So I wasn't going for a regular checkup. But I had a high blood pressure condition that I wasn't aware of. Just blindsided me. I go to work in the evening, so prior to work, I usually go about an hour at the gym before I go to work. Went in a little bit earlier, did cardio, worked out, and then at the end of my workout, went to play some basketball. And all of a sudden, I just felt dizzy. And I started holding on to the wall, holding on to my friends. He said, lift your left hands, and I barely could move my left hands. So he said, immediately call 911, his guy having a stroke. And I remember the paramedics coming by and they said, they ain't able to save this guy, we have to airlift him immediately to Grady Hospital. I mean, it was a blood clot to the brain. It was a major, major stroke. So they had to go through my body, up in my brain, and take out the blood clot. I think it was the hardest time. I mean, like I said, after 40 years of eating a certain way, all of a sudden to change that. But I think it's a change for life. Prior to my stroke, I didn't eat a lot of fruits and vegetables at all. Today, 2 to 4 pieces of fruits a day and vegetables 2 to 3 times a day. My kids, they were happy when I came home, and when they see me exercising and trying to eat right, they encourage me, and I try to get them encouraged also so we can do this together.
We want people to know that stroke is preventable and treatable, and there is hope. There are things you can do. You can work with your doctor to reduce your risk, and regularly checking your blood pressure is important.
I keep a log of my blood pressure, and it's been controlled. This whole year it hasn't gone over 120. I want to be a spokesperson for this, to be honest with you. Well, I want to say, first thing is, please, please, please go to the doctor. Get yourself checked first. It's very important. Get yourself checked, see where you are. And if you have to go on medication, do it. All my friends, I tell them every single day, listen, man, you got to change your diet 100%. Start with your diet first, and then just gradually start walking, start getting this exercise. So all my friends, I'm an advocate of being healthy and eating right now. And I think what motivates me the most is my 4 kids. I want to be able to see them grow up, to go to college, have their own family, And me passing down this eating right and healthy lifestyle, and they're passing that on to their kids. So I think that's my biggest motivation, just watching my kids grow up and showing a good example.
Great story. I mean, you have a gentleman in shape, you know, fantastic shape for that matter.
Yeah.
I mean, he wasn't eating fruits and veggies and things like that, but, you know, he experienced a massive stroke and he really didn't have like complications or history. That's not normally the case, but it can happen.
Yes.
Now, let me ask you this. Potential consequences after a stroke. I know it varies, but what are they?
So, you know, when the potential consequences after a stroke, we talk about disability and the need for rehab at that point. One of a number of things can happen after a stroke. You can be left what we call motor paralysis or inability to control one side of the body. Speech issues where you're unable to speak coherently or understand what's coming in. Memory issues. There's also sensory issues. A lot of people out there don't realize that after a stroke, the neurons can be affected or your body can be affected where pain becomes a huge issue, specifically on the side that's affected. And lastly, emotional disturbances. If you Google emotions after a stroke, there's a condition that's out there where we call hemiballismus, where a patient will be talking and all of a sudden, in a great mood, just starts crying. And it's gone undiagnosed for years. So the help of a psychiatrist and a neurologist as part of the rehab team really helps the patient. They become very self-conscious about these issues.
And that's why it's so important if you have the signs or the symptoms of a stroke to act fast.
Correct.
And that's one of the acronyms. We're going to go over what FAST is. It's such an easy word to remember, and it's so important that you do it. Seconds matter for getting the right treatment and best outcomes. But what can patients expect in recovery? We're going to get an inside look at the rehabilitation and the latest tools for helping patients recover. You're watching the Health Channel. All health, all the time on South Florida PBS. If you have a question for Dr. Vargas, give us a call. Toll-free number, 855-796-4475. Remember, you can take the Health Channel wherever you go. Visit our website, allhealthtv.com. You can watch a live stream of the show and watch previous episodes as well. We'll be right back.
A brain aneurysm doesn't care that you have important meetings. It doesn't care that you have to drop your daughter off at ballet and your son off at soccer practice. So if you suddenly experience the worst headache of your life, sharp pain behind your eye, and blurry vision, seek immediate emergency care. The Lisa Calagrassi Foundation, shedding light on brain aneurysms. Learn more at lisafoundation.org.
I am incredibly proud to be a physician here at St. Jude, to be in a place where I know my patients are going to get the top-notch care, not only care, but also research happening 24 hours a day, 7 days a week. Every single person that contributes is a part of that St. Jude family that makes that happen. Because of the research, because of all the donors, because of everyone that is really committed to the mission of St. Jude, we're giving families hope.
This is my kind of happy hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with me is Dr. Jose Vargas, a physical medicine and rehabilitation physician at West Gables Rehabilitation Hospital. If you have a question, give us a call. There's the toll-free number. Don't be shy, 855-796-4475. So this hour, we're talking about stroke and stroke care when it comes to rehabilitation. And according to the CDC, stroke is a leading cause of long-term disability. Doctor, we talked a little bit about this, but why is this? What exactly happens? I know it has to do that when you have a stroke, it goes to your brain. There's a loss of oxygen. Can you explain that to us?
So from the standpoint of when your neurologists have been here before, when you have the stroke, there's multiple ways you could have a stroke. As you get older, you have some what we call lacunar infarcts, which is just not enough blood going into the deep parts of the brain. But usually what we're dealing with, or the neurologists and the neurointerventionalists, are a blood clot that is actually gone into the circulatory system of the brain and affected blood flow to the brain. And that's why that FAST acronym is so important. Recognizing it, getting somebody to the emergency room, seeing if it's a blood clot, trying to rescue that tissue so you don't have to necessarily meet me and my team at West Gables.
Right.
Because we're seeing a lot of high-end strokes, if you will, or high-functioning strokes at our hospital, where an intervention was done and it wasn't as catastrophic, but we're also seeing the other extreme where patients have been severely affected and they have complete loss of strength on the other side. So that FAST acronym, incredibly important. And what they're doing today in some of these hospitals here locally, such as Baptist, with their neurointerventionalists, where they're coming in and with less than 3 hours already doing a procedure to save that brain tissue is amazing. Unheard of 30 years ago.
And let's just go real quick over the FAST, even though we're going to talk about it a little bit more.
Sure.
It's you look for the face. And explain what we're looking for.
I mean, from what they've put out there, I can't remember when they started this FAST, but it's a great way to think, just like we did with heart attacks.
Yeah.
You look for asymmetry of the face, we say. And in layman's term, we like to say you see one side droopier than the other. The A stands for arm weakness. Have them lift both arms up. And if one is dropping, you can tell that there might be something going on. Speech difficulties is the S for speech. Are they having troubles either understanding what you're saying or communicating what they're trying to say? And if you see any of those three, just any one of those three.
Even one, I've heard.
Even one. Time to call, T. Call 911 fast.
No matter what.
Minutes save lives.
Now, once someone has a stroke, doctor, what is the recovery process like? I know everybody's different because sometimes it can be more severe than others, and there could be more speech problems, more problems with the walking, but normally recovery as a whole.
So from a recovery standpoint, our role as physiatrists, a lot of times we'll get called into the hospital right after the stroke to do an evaluation for a patient's rehab needs. In general, about 48 hours after a stroke, we're 24 to 48 hours once medically stable, we're already trying to incorporate therapy. Getting out of the bed is important. Sitting up in a chair, begin gait, trying to see if the patient's able to stand, mobilize. Critically important. So that recovery process, once treated, starts right after the patient's deemed to be medically stable, which can be anywhere from 24 to 48 hours.
So that movement is really imperative.
Incredibly.
All right, we want to remind our viewers, jot down this phone number in case you have a phone call right now and you want to give us a call to Dr. Vargas, 855-796-4475. Once again, that's 855-796-4475. Now, to take care of patients, I know it takes a huge team approach.
Sure.
I want to go through, and I think this is very special, I always call it that multidisciplinary approach where everybody comes in to help out. There's a physiatrist, a physical therapist, occupational therapist, nursing, and nutrition. All of these go hand in hand. What is that approach, doctor?
So I would even say we probably need about 3 slides there to include everybody. The physiatrist, I stumbled into this specialty just from the standpoint, it really is a multidisciplinary approach, and we call it a team effort. You can see the physiatrist is almost as a quarterback. Sometimes we're the offensive lineman, if you want to use a football analogy. But the physical therapist, key, mobilization, getting patients up safely, helping them with transfers. The occupational therapist is that therapist that helps you with what we call activities of daily living, your ADLs, bathing, dressing your uppers, your lowers, brushing your teeth, brushing your hair, what we call functional transfers, getting to go from a wheelchair to the toilet and back to the bed. We're missing the speech language pathologist, critical in
that's right.
in rehab, and it's just another key component. Neuropsychologists, those doctors that are psychologists but have an extra focus on memory and really getting an idea of what's going on with the brain after a stroke or a brain injury. And nursing. Nursing's key. I mean, in acute rehabilitation, which is what I do, the patient's in therapy 3 hours a day, but a nurse is involved and taking care of this patient 24 hours. The doctors a lot of times get all this glory and they get a great reputation, but at most you're half an hour to an hour with the patient, and sometimes maybe only 15 or 20 minutes. These nurses are there 24 hours a day, as well are the CNAs, the certified nursing assistants, and between them and the therapists, they're unsung heroes a lot of times.
So the physiatrist is the quarterback, and possibly the nurses are the wide receivers.
Yeah, I mean, I think at the very least, and maybe you might have therapy as the running back there. And let's not forget about nutrition. You had it as the last point there. Nutrition is key. We have so many of our patients come in South Florida with really bad diets, and trying to switch that quickly to a healthy diet. When we just saw it in the video, this gentleman who was young, athletic, he was talking about how little fruits and fresh vegetables he has. How do people on a limited budget do it today?
Yes.
So, there's a lot easier to go buy that frozen food with all the high sodium and all those letters, I don't even know what they stand for, and they're not good for you. As
opposed to getting the fresh vegetables and fresh fruits, which are much more expensive. But I always tell people that it may be more expensive, but it's more expensive to be sick in the future.
Correct.
So sometimes that investment could be worth it. Can you give us an example of how do you individualize care for a stroke patient? Because you must take it on a case-by-case basis.
Correct. So not everybody reads the book. Actually, I haven't had a patient who's read the book about what a stroke's supposed to look like. So you could have two patients with a stroke in the exact same part of the brain, and they will come, very similar but very different. And what we do in rehab hospitals across the country, especially when the team's led by a physiatrist, we spend that first morning, even that first evening sometimes, getting to see what's the major issue going on with the patient? What's physically, mentally, whatever the case may be, limiting the patient, and then tailoring that program along with the therapist. We let the therapist do their own evaluations, and then we huddle and come up with a game plan after the first day or two to see what we see as the limiting factors. So we really do work as a team.
And I was thinking right now, like you said, the same stroke, two different people, two different outcomes, and even the recovery could be different for those two people as well, right?
Correct. So you never know how someone's going to respond. I mean, you could have the same level of disability, but if you have the one person who's very engaged and all in, and you're able to really encourage them, they're going to have a better outcome than someone who's feeling spiritually down or emotionally spent, or doesn't have that support in the community and their family to help them. You'll see a difference in outcomes.
Not only in outcomes, but just in the perseverance of doing it. So, which leads to my next question, and I know it's going to be difficult for you to answer, but how long can rehab last? Obviously, it depends on the situation, it depends on the perseverance of the person, the support, but normally.
So I say there's rehab for life. We all need a little bit of rehab.
I need a little bit of mental health rehab.
Right, well, that's rehab. So from a rehab perspective, when you're looking at strokes, we in South Florida are a little unique. I'm on a national committee on a few, we'll go over numbers. Our strokes leave hospitals faster than anywhere else in the country. I don't know that that's necessarily a good thing. Most complications after stroke happen in the first 2 weeks. But that intense rehab that we talk about usually lasts about 3 weeks. Ideally, you want them to be in an intense setting for about 3 weeks where they're getting at least 3 hours of therapy. I'm a proponent of a patient going home. So I believe that we get to have them for 3 weeks or 2 weeks or whatever the case may be, but as soon as they can make it home, if they have the proper support, they're going to do better because they're going to be within their network of support, whether it's their family, their loved ones, their church, whatever the case may be.
And that always helps.
That's going to help them because being stuck in a hospital for 8 to 10 days and then being sent to a rehab hospital, you can see why some people feel depressed, that they haven't been home, they haven't seen their dog, they haven't seen their grandkids. So we're big pushers for trying to get people home.
Just their own bed, for that matter.
Makes a big difference.
It really does. The multidisciplinary approach that we talked about for the patient, I can see so much benefit for the patient. I did want to ask you about the family. Do you take that approach too to help explain to the family what their loved one is going through?
So it's South Florida, and sometimes, you know, we're in a rush to do things, but what we've done at our hospital, at least, is we've set up a dedicated day for every patient where the family knows that I or my colleagues are going to be there for a set amount of time to walk through what's been going on the last week.
And how many do you get?
Almost all of them.
All of them. I love it. I love it. Abuela,
tough.
la tía, el tío.
I've had
los sobrinos.
We've had rooms full of people, and you know, I just had a family member, family right now. She has 9 children. She's 84. She had a stroke, and I met all 9.
And the children.
And they're awesome, and they're very appreciative,
great.
and you know, and it's an older woman, but just lovely people. But that time, because you know, you get that a lot. Everybody has to work, and it's tough. I'll be honest, I'm probably not going to be there 11 o'clock at night to walk over things with you. But if you know that I'm going to be there Tuesday between 8 and 11, and we can walk through it, or I'll make an adjustment for one, we can talk.
And when they get there, the 9 children, what do you talk about? What do you explain to them?
So usually it's 1 and 1 and 1 and 1, not all 9 at the same time. But what we like to do is set. I always talk about. I really have a picture of what your family member is like. You have what we call a rolling film. You knew your family member a year ago, 6 months ago, 6 seconds ago. I've only seen since they've been hospitalized. So I'd like to get the perspective of what they were doing, functionally how they were, and what everybody really thinks is going to be an outcome of this. And then what we like to do is not temper the expectation, but get a better idea of what we think is going to happen in the short term without necessarily telling them they're not going to get there long term. Because a lot of these patients require some level of supervision when they leave for safety.
You're very spiritually soothing. Have you been told that?
No.
You are.
Thank you.
I'm sure you're loved by all your patients. I also noticed I noticed he said quarterback, wide receiver, running back, huddle. I'm going to assume you love football.
Love all sports.
There you go. So are you the Tom Brady of quarterback for a physiatrist?
I don't know. I sometimes feel like I'm the backup quarterback.
Backup? No, you're the starter.
No, it's okay.
Nah.
We're a team.
Okay. It takes a village. We're going to reveal the latest technology helping rehab patients in ways like never before. Stay with us as we explain. You're watching the Health Channel, all health, all the time on South Florida PBS. As the doctor would say, hut, hut.
That was good.
If you have a question for the doctor.
That was really good.
Thank you. I caught you off guard. 855-796-4475. You can also check out our website, allhealthtv.com. I just thought of that. We'll be right back.
A brain aneurysm can strike you when you least expect it, plunging your entire world into darkness. But if you know the warning signs, you're much more likely to survive. If you suddenly experience the worst headache of your life or sharp, sudden pain behind your eyes, do not ignore it. Please seek immediate emergency attention. It's time to shed some light on brain aneurysms. You gotta know the information.
The Lisa Calagrassi Foundation, lisafoundation.org.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty. And if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
Mom, are you okay?
Don't allow your weight to threaten your health or control your future. Talking about your weight is never easy, but is important. Excess weight, or obesity, can cause emotional and physical health risks, such as type 2 diabetes, heart disease, high blood pressure, and sleep apnea. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Visit yourweightmatters.org to take the Your Weight Matters Challenge. Learn the first steps to improving your health. The free campaign toolkit will prepare you to speak with a healthcare provider about your weight and health. Your weight does matter. Take the challenge and take control today. Visit yourweightmatters.org.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good, others not so much.
But that's life.
It's when something doesn't seem quite right
that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Welcome back to the Health Channel, All Health, All the Time. I'm Olga Villaverde, and with me today is Dr. Jose Vargas, a physical medicine and rehabilitation physician at West Gables Rehabilitation Hospital. If you have a health question for the doctor, give us a call. Toll-free number, 855-796-4475. So rehabilitation can be important for stroke recovery, giving patients the opportunity to improve their quality of life, and that's what we want, to improve their quality of life. So doctor, what is life like after a patient has, I guess, done their stroke and they're moving forward? I'm assuming they're worried they may have another one. How do they move on? Do they get checked up after? Lots of questions.
So, number one thing we do at hospitals across the country is ensure follow-up. I think the key for a stroke patient is follow up with the primary care physician. We ensure that the patient follows up with a neurologist or cardiologist as necessary. And from an education standpoint, I mean, the key is always going to be education. We have to make sure they understand the medications they're taking and helping to decrease their risk for a follow-up subsequent stroke, which is one of the highest, besides atrial fibrillation, recurrent strokes, huge factor for these patients. So in terms of what are the next steps, at least at our hospital and others that we associate with, we like to make sure the home is a safe environment. We'll go and evaluate their home, make sure everything is safe, so we have a safe discharge. Again, educating not just the patient, but the patient and their families, and ensuring that we have a smooth transition, handing off the patient records to their primary care, giving them that appointment so they have it when they leave, and that's all part of the process of leading a top rehab hospital. And that's what you should be looking for when a loved one, you know, God willing it doesn't happen, but if you have a loved one that has a stroke, you want to make sure that they're following not just the standards, but above and beyond. And part of that comes with that special accreditation that some of these rehab hospitals have that we've talked about, which is called CARF and Joint Commission accreditation.
Now, new technology has obviously evolved in terms of with rehab. How has stroke rehab evolved, you would say, over time?
So if you were to look at rehab 60 years ago, we were talking about the shell shock patients. People would just stay in bed and they would be in a convalescing, right, for 3 to 6 months. Even 20, 30 years ago, strokes would stay in a hospital for up to 2 months. with technology, it's not that we're just necessarily trying to get patients out of the hospital, at least we're not trying to. It's really about the mobility aspect. And I think a lot of the focus on rehab in the last, as it relates to stroke, has been on mobility and what is the latest and the greatest. Some of the things that we've done with computer-generated programs. We have smart TVs. We even use the Wii to do programs to help with coordination. There's funky goggles that we use to help patients suffer from something we call neglect, which there's a spatial distortion where they essentially ignore one side of their body. So these goggles help you go from that end. There's different aspects in physical therapy called body-supported weight treadmills. And there's the exoskeleton, which is amazing. The Exo GT, something we just picked up, and it's space age, if you will.
And we're going to talk about that right now. Before we do, I just want to remind our viewers once again, the phone number in case you want to call in, 855-796-4475. That's 855-796-4475. So you teased it, so we're going to do it right now. The Exo GT. Give us an overview of this latest technology.
So, I mean, you see it right there.
Oh, that's cool.
Actually, when I walk into the gym, it's usually in a seated position, just like that. And you'll get a therapist to strap you in. It's a battery-powered exoskeleton.
Oh, my goodness.
FDA approved for stroke and spinal cord injury, which we also take care of at our hospital. But you can see the difference between stroke and spinal cord. You're talking about 800,000 lives versus 17,500 a year, about. You're going to see a lot more use with this machine in strokes. You can tell right there that the machine is helping that woman lift her left leg. You see how it's it seems a little stiff, but it's actually what it's doing. It's getting the patient up and walking and approximating an appropriate gait pattern. And patients feel more confident walking that way.
So it's basically first a wheelchair, if you will, and then when they get up, it becomes, I guess, a support system that helps them start moving their bodies. That is the coolest thing I have ever seen in my life.
And it has become the next great thing that we're doing in rehab. Patients feel so much happier when they use this. Their gait pattern improves. They're averaging about 400 steps the first time they use it. It allows the therapist to control the patient without having to have 2 or 3 people next to them. It's pretty amazing. And you can control one side versus the other with their software.
Depending on maybe how strong
where the
one
weakness
is.
Okay. Correct.
What is the gait pattern that you said? What does that mean?
So gait means how one walks. So we, in therapy, like to promote what we call a normal gait. So sometimes you'll go, well, maybe I'm the only one that does this, and other physiatrists will go to the mall, sit down, and you see how people are ambulating, and you can tell there's something off.
You mean you're not shopping?
No.
You're sitting down?
Just watching, observing. I talk a lot, so it's a rare instance that I just observe, but you see how people are walking. You can tell right away if they have a hip issue, an ankle issue, and with stroke, people start adjusting how they ambulate, and that leads to more problems. You start having more back problems, increased risk for falls. They're not clearing their foot enough. And a lot of our strokes are obviously elderly. So you have the osteoporosis issue. They fall, they break their hip, and now you have a stroke who's had a broken hip, and it just life becomes a little bit more complicated. Even more complicated than after the stroke.
All right.
This machine's awesome.
No, I want to go back to the machine if we can and show that B-roll once again of the patient using it, because I'm really fascinated by this. So there's the Exo. Do you individualize what you're going to be using it for, depending, of course, on the patient's stroke and what happened?
Yes. So what we have is the therapists have to undergo specialty training. I think it's 2 levels of training. That's the computer right there that controls what percentage the Exo is doing versus what the patient is doing in terms of the gait. Are they always
holding the patient, or do they let go?
Usually they're holding the patient. Our experience at our hospital, there is someone right there with the patient checking on how they're doing. As you see the patient get stronger, especially I've seen it with spinal cord patients that have experience, they're doing it on their own. Wow. And you have to be, pretty strong from that end. There's certain criteria. It's not for everyone. You have to have an ability to stand for 15 minutes. Your blood pressure has to be controlled. You can't be afraid of tight spaces. But I'm not expert in terms of the EXO. We've been using it in our hospital since last year or this past year. But within our corporation, most of our hospitals have at least one or two of this. And when I went up to visit a colleague of mine, I called my CEO and I told him, we need to have this. This is a game changer.
It's a game changer, yeah.
And I was fortunate enough that he got it for us.
It's fantastic. I saw how they strapped her in, and obviously she's being able to elevate herself.
Well, the EXO can help you stand up.
No.
Yeah. So the EXO will help you get up as well. It's pretty amazing.
And it goes to the speed that the patient can go, obviously?
Right, so it's controlling all of those factors. We're having a lot of fun with it from that end. Our therapists love it. We have, I believe we have 3 or 4 therapists that have undergone the special training. And I just signed, I guess today I had 2 patients that I gave orders that could progress to the EXO because they were medically stable to have it.
And what if one would just be a devil's advocate here, what's the difference of somebody using like el burrito, that's what I call it. How do you say it? The walker?
The walker.
Right, the walker with the help of a therapist next to them, right? As opposed to having the EXO maybe push them more.
So come by our hospital and I'll show you the difference. What ends up happening is when you're trying to promote a good gait pattern, it's not that easy. What we'll do is we'll actually have 3 people perhaps standing with that patient, and you'll have someone behind the patient with the walker, and then you'll have someone helping to guide the patient with the affected leg to promote the good pattern. So you're helping to push that leg or push that leg. I'm not the physical therapist, I'm just telling you how we, we see it and what we talk about in therapy. Whereas with the EXO, the patient is really doing it, and you can grade it. Anywhere up to 90% of the work is done by the EXO. And as they get better, they're dropping less and less. I think that's being used, I read somewhere, in 260 hospitals throughout the country. They just took their 100 millionth step right now.
Wow. Can you imagine the impact on the recovery of these stroke patients? It's got to be having a huge impact.
And it's been used off-label for a couple other diagnoses, like MS, Parkinson's, spinal cord.
I thought of paralysis too.
Yep.
I thought of that immediately because we had Mark Bonacani on one of our shows,
Sure.
and I thought of him immediately in terms of someone that has been paralyzed that could help as well. Great stuff. Okay, so we're going to take a quick break. I'm really fascinated with this EXO. When we come back, we're going to go over important tips that can be lifesavers when it comes to stroke. We're going to go over that fast again, the acronym. You're watching the Health Channel, All Health, All the Time on South Florida PBS. If you have a question, please call us using the toll-free number, 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. We'll be right back.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge, and your help, we can save them all.
Everyone deserves a decent place to live.
Everyone.
When a future homeowner partners with Habitat for Humanity to build or improve a home, they build a better future for themselves and their families.
For my family.
For my family.
For my family.
With a little help, we all have the potential to stand on our own.
Potential.
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 Visit Habitat.org to provide help to families like these today.
If you're like me, when you have the flu, you don't want to go anywhere. And when your kid has it too, life is just awful. And why should you go anywhere when you'll probably feel better just staying in bed anyway? That's why Baptist Health's Care on Demand is so crucial. Care right from your bed.
How are you feeling today?
Yeah, we've been sick for a couple days now. I can even get my prescriptions ordered through my care provider after my visit. Hey, hon, could you pick that up at the pharmacy on your way home? And it's care right away, not hours of driving in the car and then sitting in a waiting room. Because when I have the flu, there's only one thing I feel like doing.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with me is Dr. Jose Vargas, a physical medicine and rehabilitation physician at West Gables Rehabilitation Hospital. I want to remind you, if you have a question for Dr. Vargas, there's the toll-free number, 855-796-4475. So having a stroke means the brain is not getting enough oxygen, and in turn can lead to very serious consequences. That is why seconds matter so much. Knowing the signs or symptoms can save your life. Take a look.
When someone is having a stroke, every minute counts. Just as putting out a fire quickly can stop it from spreading, treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing, from one or both eyes. 4. Trouble walking, or problems with balance or dizziness. 5. Headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast. Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
Not about that.
And it's not only important just to know it for yourself, but someone else as well. You've encountered seeing someone like that, and I know you're a doctor, but you knew what was going on.
Well, we had a feeling. I was much younger. I was still in training, actually up in New York, in my former life as an internist, and we acted quickly. But one thing I was saying about FAST, and it's just great to keep emphasizing that, but for the audience to remember, a lot of times when patients come into the emergency room, very common story is they weren't feeling well, so they went to bed, and then they woke up the next morning, essentially how we see them now, and you've lost that window. So I think it's important from an education of not just the patient, but also the family members to be aware. If your family member is not doing well and you see any of these symptoms, don't tell them, hey, let's go sleep it off. Let's call that 911 and really get to the emergency room. And let's talk about this and get it seen by a professional. You wouldn't come to my hospital because we're only taking care of you after the stroke, but you need to go to one of these great emergency rooms now and get taken care of. So really emphasize on that.
And we have on the phone Dr. Ann from Fort Lauderdale. Ann, how are you?
Thank you. I am well. Thank you for taking my question.
No, thank you for calling in. I know you have a question regarding that amazing technology, EXO.
Yes, I just saw it. I just happened to I always watch you every day. But in particular, this XO, I have a friend who was diagnosed lately, she's had for 7 years, progressive nuclear brain disorder. First, she was diagnosed with Parkinson's, then MS. Now, this is the latest that they told her for the past 3 years. She has difficulty manipulating her steps. She has difficulty in talking. She stutters. So, would she benefit? Would she be able to be assisted with this XO?
Perhaps. I think from the standpoint, what you need to really have her do, does she happen to be in the Fort Lauderdale area?
Yes,
or is
she is. Yes, she is. She's about 2 miles down from me at the Hermitage.
So I think from the standpoint is she should first go to her primary care physician, arm her with the knowledge of what you've seen, and then I would recommend you refer her to a rehab physician to see her or a rehab hospital from that end, because most of these exos are going to be in an inpatient setting. You won't see this in an outpatient setting, and your family member or your friend, might benefit from a good evaluation. She might need to come in and be hospitalized for a week to 10 days and work on her balance and her strength. But she quite possibly could benefit from it. It's a little difficult to make the assessment over the phone, obviously.
Right, so where should she be going? Which hospital would you recommend?
Well, I mean, from the EXO standpoint, our hospital in Miami does. That might be a bit of a drive. We're right off the Palmetto and Coral Way. I'm not trying to plug us, but you can go on EXO's website and they'll probably be able to give you an idea of what other hospitals in your general area might have the exoskeleton and to see if she qualifies for it.
And let's spell EXO for Ann so she can look it up correctly, because it can be spelled many different ways.
EKSO.
EKSO.
GT.
GT. EKSO-GT. Fabulous stuff. Before we wrap up the show, I do want to show Life Simple 7. Again, they say Simple 7 because if you take care of these Simple 7, you'll live such a healthier life. Active, manage blood pressure, control cholesterol, eat better, reduce blood sugar, lose weight, stop smoking. Again, all of these things, big difference they can make in your life. So, I mean, I think from the standpoint, I think you could apply this to any of the diseases that we're trying to tackle today as a society. And I think key is eat right and exercise, physical activity. I'm wearing one of those fancy watches that tells me I haven't walked for 30 minutes today. So I get alarms if I'm not walking. So it applies to all of us. That's fantastic. So I think that's key. I think you're 100% right. And then I want to emphasize again the acronym FAST, because the doctor is very passionate about it. If we could put that up once again, just to remind our viewers, doctor, if you see somebody with the face drooping like you explained to us, arm weakness, speech difficulties, time to call, the acronym is FAST. Act fast because? Because you said so? No. We don't want you to have a stroke. Not because I said so. We want to attack that stroke and make sure we get the person better before, they take a turn for the worse. So face, remember, arms, speech, and time, 911. We have to act fast because time is golden. We have a 3-hour rule where if we can get to you within 3 hours, there's lots of interventions that can be done by these very specialized physicians. You're very funny. To avoid me. He's so funny. I want to show one more time our viewers the EXO GT. Sure. Fascinated by it. We only got about a minute left, but in case someone just joined us, give us a few sound bites on how fabulous this new technology is. This is state of the art. This company, I don't really know much about them other than the machine itself, really helping people become more independent, ambulating with less assistance. First time they're on it, they're walking more than 400 steps. As a company,
They're in 260 facilities throughout the country. Patients are leaving the hospital feeling more confident and walking with appropriate gait pattern, as we talked about before, which is how somebody ambulates, less risk for falls, better sense of self and worth because they find themselves ambulating like they did before. So we're all about making people feel better about themselves.
From internal medicine to physiatrist. So glad you made the change.
Thank you so much.
Thank you so much. I do appreciate your time. It was really a pleasure to have you and a pleasure to meet you.
Thank you.
You are a very soothing doctor.
I'm going to keep that.
Okay, you do. Thank you so much for joining us today, and thank you, Anne, for calling us in. Hopefully your friend can benefit from the Exo GT. Be sure to join us next time on the Health Channel, All Health All the Time on South Florida PBS. Follow us on Facebook, Instagram, and Twitter using the hashtag AllHealthTV. And please be sure to visit our website. It's really great, allhealthtv.com, where you can watch a live stream of the show and watch videos from previous episodes. I'm Olga Villaverde. God bless you. We'll see you next time. Take care.